Welcome! Today we're diving into hypertrophic cardiomyopathy, or HCM. This heart condition can be complex, so we'll break down what it is, why it happens, and how it's managed. So, what causes HCM? The primary culprit is genetics. It's usually inherited, meaning it's passed down through families. These gene mutations affect the proteins responsible for heart muscle contraction, causing the heart muscle to thicken abnormally. While most cases are genetic, sometimes the cause remains unknown, termed as idiopathic HCM. Let's talk about what's actually happening inside the heart. In HCM, the heart muscle, particularly the septum, the wall between the ventricles, becomes abnormally thick. This thickening can obstruct blood flow out of the heart, especially during exertion. It can also make the heart stiff and less able to relax and fill with blood properly. This impaired filling and outflow obstruction can lead to a variety of symptoms and potential complications. HCM affects about 1 in 500 individuals in the general population, making it a relatively common genetic heart condition. Because it is often asymptomatic, many people may be unaware they have it. It affects people of all ages, genders, and ethnicities, but it may present more frequently or severely in certain populations. The signs and symptoms of HCM can vary widely. Some people may have no symptoms at all, while others experience significant problems. Common symptoms include shortness of breath, especially during exercise, chest pain or discomfort, palpitations, a feeling of rapid, fluttering, or pounding heartbeat, dizziness or lightheadedness, and even fainting. In some cases, the first sign of HCM may be sudden cardiac arrest, making early detection crucial. Diagnosing HCM involves a combination of tools. A physical exam, listening to the heart with a stethoscope, can reveal a heart murmur. An electrocardiogram, or ECG, records the electrical activity of the heart and can identify abnormalities. An echocardiogram, or ultrasound of the heart, is the primary diagnostic tool, allowing doctors to visualize the heart muscle thickness and assess blood flow. Sometimes, a cardiac MRI may be used for a more detailed assessment. Genetic testing can also be used to identify specific gene mutations. HCM can be classified based on whether the thickening of the heart muscle obstructs the flow of blood out of the heart. Obstructive HCM involves the thickening of the septum that blocks the outflow of blood from the left ventricle. Non-obstructive HCM is characterized by thickening without significant obstruction. There are also variations in the location and pattern of hypertrophy, which can influence symptoms and treatment strategies. Treatment for HCM focuses on managing symptoms and preventing complications. Medications are often prescribed to slow the heart rate, improve heart relaxation, and relieve obstruction. Beta blockers and calcium channel blockers are commonly used. In some cases, a surgical procedure called a septal myectomy may be necessary to remove a portion of the thickened septum and relieve obstruction. Another option is alcohol septal ablation, where alcohol is injected into the artery supplying the thickened septum to cause it to shrink. An implantable cardioverter defibrillator, or ICD, may be recommended for individuals at high risk of sudden cardiac arrest. While HCM is primarily a genetic condition, lifestyle modifications can play a role in managing symptoms and improving overall heart health. These include regular exercise under the guidance of a doctor, avoiding strenuous activities that could trigger symptoms, maintaining a healthy diet, and managing blood pressure and cholesterol levels. Genetic counseling is also important for families with a history of HCM to understand their risk and make informed decisions about family planning. The prognosis for individuals with HCM varies. Many people live long and healthy lives with proper management. However, HCM can increase the risk of heart failure, atrial fibrillation, and sudden cardiac arrest. Regular monitoring by a cardiologist is essential. Recent research focuses on developing new medications that target the underlying genetic causes of HCM and preventing disease progression. There is ongoing research in developing therapies to improve relaxation of the heart muscle and preventing sudden cardiac arrest. By supporting continued research, we can strive to improve the lives of individuals affected by this disease.